outbreak in the school. And my understanding is that was with the Delta variant.
Well, COVID cases in kids have increased fourfold in the past month. The Children's Hospital Association sent a letter to President Biden yesterday saying that they are worried about running out of beds. And you have repeatedly said schools can reopen safely if they follow the layered prevention strategies outlined by the CDC. But yesterday in his podcast, Dr. Michael Osterholm said these guidelines have done a disservice to schools and parents. He said they are largely based on studies done with previous and less transmissible versions of the virus and no longer apply under Delta. He said, who in their right mind believes that an aerosol is only going to be transmitted 3 feet and that plexiglass will make a difference? That's just wrong to continue to promote that. And the CDC guidelines do that unless educators have become convinced that they can reopen their schools safely. We have misled them. In light of the recent large increase in pediatric cases and the amount of transmission we're already seeing in schools, do these guidelines need an update? Do you stand by the idea that schools can be open safely if they follow them?
Thank you for that question, Brenda. We have seen outbreaks in schools that are occurring now in the context of not following these layered prevention strategies. These layered prevention strategies include not only vaccinating everyone who's eligible for vaccination, not only masking, cohorting, ventilation strategies, screening strategies, hand hygiene, the whole layered mitigation. And where we have seen these layered mitigations properly employed, we have also seen that cases really are reflective of what's happening in high community transmission. But we have also seen that the cases are not propagated in the schools. And in fact, that schools tend to be safer places for our children than the communities in terms of COVID spread.
Next question.
Liz Sabo at Kaiser Health News.
I don't think we're hearing Liz.
No. All right, next question. Let's go to Tom and Christopher.
Oh, hi, it's Liz.
Hey, Liz. Okay.
Hi, sorry about that. I had a question on the number of vaccinations. Do we have any idea if these are first-time vaccinations or if these are people coming in for the worried well coming in for a third dose?
The 1.1 million that was reported today, there were about 500,000 of people coming in for their first dose. And as I said, that's really important and part of a real acceleration of first doses that we've seen across the last several weeks, and very encouraging. Immunocompromised are eligible for a third dose, and we're seeing some increase there as planned. But the vast majority of the doses are first doses, and then people coming to complete their first dose 3 to 4 to 5 weeks later per the plan. So the vast majority of the doses are made up of first and second doses, but we are seeing some doses for those who are qualified for their third dose as they're immunocompromised. Next question.
All right, Tom and Christopher.
Hello. Yes. Thank you for the briefing. My question is sort of a 1.5 part question, really. The first half question being, I'm assuming that you still haven't received any guidance from the Justice Department on whether or not the federal government has the authority to institute a national mask mandate, but you can correct me if I'm wrong about that. And so my question is, for each one of you, just to be clear, if you had your druthers, would you prefer that every American be covered in some way by some sort of a vaccine mandate, be it local, state, employer, et cetera?
So we have no plans or authority for I think what you called a national mask mandate. The president has taken significant action on vaccination requirements across the federal government, across the military, across health providers that are at the Department of Health and Human Services and at the VA. and then also use the power of the government as payer through CMS, which is Medicare and Medicaid, to require vaccinations for nursing home workers, in that the data is clear that when nursing home workers have a lower level of vaccination, that residents get infected and suffer the consequences of COVID at a higher rate. And the president will continue to look for every lever he can pull on vaccination requirements. And we're all very heartened by the fact that private sector, public sector, schools are following suit with vaccination requirements. Next question.
All right, and a reminder, keep your question to one question. Dan Vergano, BuzzFeed.
Thanks very much, Dan Vergano, BuzzFeed. For Dr. Walensky or Dr. Fauci, we're wondering if you have a view on the hospitalization rate among children diagnosed with COVID-19. We're relying on AAP suggesting it's about a 1% rate for children diagnosed with COVID-19 resulting in hospitalization, but some hospitals are telling us they're seeing much higher rates, like around 15%. And so I'm wondering if you could offer some perspective on what you see as the rate. Thanks very much.
Dr. Walensky?
Sure. What we're seeing here is increasing in cases across the country, and therefore increasing cases in hospitalizations of all age demographics. They tend to be consistent in terms of across the age demographics, meaning that the rates of hospitalization are actually higher among older age demographics than they are in the pediatric age demographic. But because the absolute number of cases is so high, the absolute number of children who are coming into the hospital is high. It's also the case that we are currently within a surge of RSV cases as well, respiratory syncytial virus cases. Many of the hospitalizations that are accumulating in pediatric hospital beds are infected with RSV. We're seeing RSV rates similar to what we generally see in the winter months. So that is actually also contributing to the hospital bed, pediatric hospital bed crunch.
Next question.
Last question. Let's go to Josh Wingrove at Bloomberg.
Hi, sorry, just to follow up on a couple of them. Are you reviewing the school guidance in light of Delta? Will it be updated, or is the guidance as exists now the guidance that will exist for the school year, or at least the start of it? And is the hospitalization rate higher than what we understand it to be? Do you have data on that? You said it's rising just because all cases are rising, but do you have numbers on that?
We are not looking at updating our school guidance right now. I can tell you that most of the places where we're seeing surges and outbreaks are in places that are not implementing our current guidance. The hospitalization rates that we're seeing with children right now are similar to prior surges. It's the absolute number of cases that we are seeing as increasing.
Well, thank you, everybody. We'll look forward to returning to our normal format next week, and I hope everybody has a good weekend. Thank you.